Welcome to IMCAS TV, 10 Minutes with Dr. Stevens. Welcome back. You're going to talk today about Cellulaze, Cellulaze, and your personal experience with Cellulaze. Cellulaze is an energy-based device which addresses and attacks the problems that laser can't. Problems under the skin surface that cause cellulite. Dr. Stevens, you are a board-certified diplomat of the American Board of Plastic Surgery, professor at the University of Southern California Division of Plastic Surgery, director of the USC Marina Del Rey Aesthetic Surgery Fellowship, and the medical director of Marina Plastic Surgery in Marina Del Rey, California. The first question is obvious, but if you could give us a little background on cellulite, what exactly is it and what causes it?
Well, I think most of us know what cellulite is, in that when you see it, it's the dimpling and the cottage cheese changes over the skin of a woman's thigh and buttocks and so forth. It's interesting, but 85% of all women, regardless of how big they are or how small they are, do have problems with cellulite. And what it is caused by is primarily estrogen. Men do not get cellulite. Women do. So we know that estrogen plays a role in the cause of cellulite.
It's interesting.
And what we find is that there are three underlying problems. There's the thinning of the dermis, and there's the fibrous septae, which pull down the skin and make those characteristic picks and dimples. And then finally, there's bulges of fat, which make the high areas of the fat underneath the skin.
And what makes Cellulaze so unique and different from anything available today for cellulite treatment? How does it work?
Well, first of all, Cellulaze is a very unique laser. It's a side-firing laser, which is a 1440 nanometer laser, which one gently puts underneath the skin, and it addresses those three underlying problems. I mentioned to you the three causes of cellulite. Well, the Cellulaze has the unique ability, the only, in fact, ability to treat all three of those, which is to thicken the dermis by turning the laser towards the skin,
right,
to cut the various fibrous septae with the side-firing laser, and finally to get rid of the bulges of fat. So Cellulaze is a unique proprietary method to get rid of the three underlying causes of cellulite.
Yeah, I think we have a video. If we could go to the video, it will explain a little more.
Fabulous. Estimated that 85% of adult women have cellulite, and I think the other 15% think they have it. Cellulite itself is the thinning of the skin, the dimpling and that contour irregularity, along with the picks, which are the depressions caused by the fibrous septae, which are pulling down the skin. Finally, there's extra fat beneath the skin causing that cottage cheese look. So there's three parts that actually cause the cellulite: the extra fat, the thinning skin, and those fibrous septae. And we've used many techniques to get rid of cellulite. There's been rollers and potions and lotions and lasers and all kinds of things have been tried, but nothing until just now has been successful. Cellulaze is the first effective long-term solution for cellulite. Cellulaze employs a tiny fiber optic laser that allows us to go gently under the skin through a tiny pinhole. This is a minimally invasive procedure. The laser can be aimed upwards, sideways, and downwards by your doctor to treat the three problems of the skin architecture. Melissa has moderately severe cellulite. In fact, on the Stevens cellulite scale of 1 to 5, I would give her a 4. So we can really do a lot to help her today with the new Cellulaze. This is the laser firing down. The bright light accounts for about 60% of the energy. Then you have some energy going forward, which helps us move through the tissue. The bright light is doing most of the work to eliminate the cellulite.
I'm a little nervous about the Cellulaze procedure, but I trust Dr. Stevens to do a great job.
Rules are 1,000.
All right, 1,000 joules.
47 degrees.
With a shut off at 50
Close to
44 degrees. Melissa's procedure is finished now, and she's done great. She tolerated it very well, she was comfortable the whole time, and we could feel those little irregularities disappear with the laser.
It's been 3 weeks since my Cellulaze procedure, and my cellulite has gotten a lot better. It's supposed to keep improving for several months.
Melissa is 3 weeks out now from her Cellulaze treatment and she's looking terrific. Her thighs are smooth and the pics are gone. Her cellulite is eliminated.
Welcome back, Dr. Grant Stevens. The patient we just saw is your patient.
Yes.
Can you tell us about her experience?
Well, Melissa was the first patient that we treated. She's actually the director of our front office, so she's my employee and my patient.
So she sees it from all sides.
Absolutely, and she's done very well. She's now about 1.5 years out, and the most impressive thing about Melissa is she now can wear her bathing suit and her shorts. She revealed to me recently that before this procedure, she was so self-conscious about the dimpling and the cellulite that she wouldn't wear shorts and she didn't wear a bathing suit without a wraparound.
What an incredible, incredible thing for her confidence and as a woman.
She told me that with tears of joy.
Good. And about your own personal experience with Cellulaze, how long have you been offering the procedure in your office, and what kind of patient outcomes are you getting?
We've been offering the Cellulaze for a little over 1 year. As I said, Melissa was our first patient. We've done about 50 patients. And Dr. DiBernardo, who introduced this whole technique, has been doing it for over 3 years. So he has 3-year follow-up, which shows the same type of results. My results so far have been over 1 year, and all of our patients have been happy.
Oh, no risk complications?
No. Well, of course, there are some risks, and we have had no complications. There's some bruising. Patients do wear a garment. But the beautiful thing about this is many patients are having this under straight local anesthesia with no sedation. All the rest are having it under local with a little bit of oral sedation. So one doesn't have to go to sleep. People can drive themselves to the office and home after the treatment even.
And you're seeing long-lasting effects?
Yes, we are.
Long
We have 3-year follow-up with Dr. DiBernardo's work.
Oh, wonderful. And what ages are your patients?
We find that people are coming in their young 20s complaining of the dimpling and cottage cheese. I did a 67-year-old lady recently who I'd done a mommy makeover on before with liposuction and tummy tuck.
What's a mommy makeover? Excuse me.
A tummy tuck and breast surgery done at the same time. But she was troubled by the dimpling, and she's 67. She said it bothered her whole life. She got up on the table, and in 2 hours, it was smooth.
It was fine.
Yeah,
it was
absolutely.
fine.
This is a revolutionary procedure. You know, up until now, we've had rollers and potions and lotions and all kinds of techniques, but none of them have been working in a long-lasting fashion.
And is there a pre-procedure or a post-procedure that your patient needs to do before Cellulaze or after Cellulaze?
There's no pre-procedure. After the patients do wear a garment for a short period of time, and they limit their physical activity until all the bruising and swelling is gone.
So the only real complication is the bruising, and that seems to go with all the laser territory.
Yes, yes, there's nothing unique about that.
And where do you see Cellulaze's future?
Oh, the future is enormous. With 85% of the women having cellulite, and so it's prevalent everywhere, and this is an easy procedure. I think you're going to see tons of women coming in for this procedure.
And
I know the patients I have that I've done are telling their friends and family about it. They're coming in droves, and they're jumping up on the table because they want to wear their bikinis and they want to wear their shorts, and they're tired of dressing around their cottage cheese and their cellulite.
And this is a procedure that you don't have to do every 6 months. You don't have to do every year.
That's right. It's not coming in for 10 treatments. It's coming in for 1 treatment.
That's wonderful.
It really
wonderful.
is.
Cellulaze.
Cellulaze
Now,
by Sanjay.
I have another question. So you're getting all ages.
Yes.
All ages. Is Cellulaze being treated for anything else but cellulite?
Well, we combine it with liposuction and smart lipo, and we'll also do it at the same time to reduce the bulges of fat. Some women complain of extra fat in addition to the skin changes or the cellulite. So we can do it at the same time. We can reduce the bulge of fat while doing the Cellulaze treatment for the cellulite.
Yeah, combination therapy today seems to be the theme.
That's right. We're busy. We don't have time to come back multiple times.
No. So everything gets done in one shot.
That's correct.
And safely.
Absolutely.
Well,
and easily.
And easily. Dr. Grant Stevens, thank you so much for
You're
sharing
welcome.
your
Thank you
expertise
for having me.
and letting us know about Cellulaze. Thank you.
You're welcome.